I'd like to tell you some additional information about breast augmentation surgery, which is one of the most commonly performed procedures in the United States today by board-certified plastic surgeons. There are basically 3 decisions that must be made during your consultation. It depends upon your anatomy, your age group, and the goals of your surgery. The first is the choice of the implant. Is it a saline implant or is it a silicone implant? And within that subgroup, there are many different types of silicone implants. It is not like we did 25, 30 years ago. There was one type. We can vary the dimensions of the implant, the base width, the vertical height, the projection, and even the shape of the implant. And those will be addressed during surgery. The second is where are we going to insert the implant. So there are 3 places that we can do that: through the armpit, through the areola, what we call a periareolar incision, that's the circle around the nipple, or inframammary, which is below the breast. There's the relative advantages and disadvantages of each procedure. The third decision that must be made is where is the implant placed in relationship to your pectoralis muscle or your chest muscle. It can be above the muscle or below the muscle, each with its obvious advantages and disadvantages. Prior to surgery, as in any operation, we ask that you not take anything that interferes with clotting, such as vitamin E, Motrin, Advil, or especially aspirin. As surgery is performed under general anesthetic or a deep sedation anesthesia. The operation takes between an hour and an hour and a half, and you'll stay in the office facility for approximately 1 hour after surgery. Your downtime from work should be no more than 3 to 5 days, whether or not it's placed above the muscle or below the muscle. After surgery, you'll have pain for approximately 1 night to 2 nights, and pain medication that we give you prior to surgery will certainly help. Another concept which is absolutely essential to understand is that the implants that are placed in you at the age of 20, 30, 40, or 50 statistically will not be the ones that you have for life. That sometime they're going to have to be replaced. It's a device, and it does have to be replaced. The FDA tells us that a life expectancy of the implant is about 5 to 7 years, and you should be monitored by your breast surgeon after surgery. If you have any additional questions, be happy to answer them. You can email us, or hopefully we'll have the opportunity to meet you in person at consultation. Thank you.